Hi everyone, my name is Faatima Adam. I'm a PhD candidate at Stellenbosch University in South Africa, part of the Division of Sports and Exercise Medicine. Very passionate about parasport and protecting the health of para-athletes, particularly around increasing the understanding of the health of para-athletes living and training in Africa and low to middle income countries. And that is the focus of my PhD. Today, I'll be sharing with you one of my PhD studies, which is a qualitative study titled We Make a Plan, a qualitative study describing healthcare pathways, perceptions, and experiences of para-athletes and coaches from African countries. So if we start off with some background and we look at disability and healthcare globally, there are about 1.3 billion individuals with a disability worldwide, and about 80% of individuals with disability live in low and middle income countries, with about 60 to 80 million living in Africa. When it comes to low to middle income countries, research shows that there are barriers to healthcare, challenges around affordability, accessibility, infrastructure, and social economic challenges. And so, as part of the universal goals or sustainable development goals, there's been a drive to increase education, health, and well-being that are inclusive of individuals with disability. However, while there have been efforts towards this, when it comes to health and research, individuals with disability still remain quite marginalized. If we look at disability and healthcare in Africa, so sub-Saharan Africa, based on the GNI per capita, falls within many of the regions or countries fall within the low to middle income bracket. And there are vast social, economic, and disability divides in the regions, with unemployment challenges, particularly for individuals with disability, an increased rate of unmet health and medical needs for individuals with disability as well. In South Africa, a study showed that individuals with disability have a rate of 24% when it comes to unmet healthcare needs, compared to individuals without disability, which is about 12%. There's also a high rate of non-communicable diseases, which are disproportionately higher for the population with disability. And as many of us know, that's often a two-way relationship when it comes to NCDs and disability, with either an NCD leading to a disability or having a disability increasing your risk of having a non-communicable disease. Then, when it came to the rationale of our study, obviously focusing more on individuals with disability that are active or participating in sports. So one of the ways in which improvements in health and social economic challenges has been overcome or is through disability sport. And in Africa, there's been a lot of grassroots development with the IPC's Adidas Foundation and the Commonwealth Games Federation GAPS Africa Parasport program that have done really well towards increasing inclusivity and improving health and social economic disparities through sport. And there's been an increase in the amount of, or the number of para-athletes from African countries competing internationally. We've got about 45 national African National Paralympic Committees. In 2023, the first Africa Para Games were hosted in Ghana, and at the Paris 2024 Games, there were approximately 300 para-athletes that competed from African NPCs. And so this brings us to the question of, with this increase in the number of African para-athletes competing internationally, what do the healthcare experiences of these athletes look like, given what we know about disability and health in African regions? So we conducted a research study during the Commonwealth Games Federation GAPS Africa Parasport Camp in Stellenbosch in South Africa. This camp took place in August 2023 at Stellenbosch University. So the Commonwealth Games Federation GAPS Africa program is a parasport development and inclusion pathway program designed to support emerging para-athletes from Africa. And we had para-athletes from 12 different African countries participate in this camp. Athletes that participated in the camp participated either in parathletics, table tennis, or powerlifting. And during the camp, we had two focus group discussions that were held and moderated, one with coaches and one with athletes. And the aim of this focus group is to explore the home country healthcare experiences and perceptions of healthcare services of the coaches and athletes in their countries. We used a basic qualitative research design, as this was a novel study, and a latent thematic analysis by Braun and Clark to analyze the data. If we look at the athletes' country representation, so we had athletes from different regions across Africa. A lot of the athletes coming from the Southern African regions. That's most likely because of logistics. It was held in South Africa, but we had athletes from East African regions and West African regions as well. If you look at some of the demographics of the focus group participants, so there were 12 athletes in the one focus group and 12 coaches, both male and female, and the average age of athletes was 29 years. We also divided the African regions on income status based on the World Bank income classification. And as you can see, most of the athletes resided in African regions that fell within the low income or low to middle income bracket. In Southern Africa, we did have one athlete and two coaches from upper middle income country. And then athletes had either neurological, musculoskeletal, and we also had athletes with visual impairment participate. And so based on the demographics, when we get more into the themes or results, it's just important to remember or consider that the coaches and athletes that shared their healthcare experiences, 88% of the participants were residing in low-resourced countries. And so when it came to the theme that emerged from the data that were generated, the first theme is what we called polarization, promise, and provision. And this theme looked at athletes and coaches' experiences that they shared and the disparities in infrastructure, service provision, and healthcare access across the regions. So we had athletes either within the same, athletes or coaches either within the same regions, so within Southern Africa, but different countries actually have different healthcare experiences. Some were in a more well-resourced settings, others were not. And then we also had differences between regions. So athletes in East Africa having different healthcare experiences compared to those in Southern Africa or West Africa, and others had similar healthcare experiences. And that's why we named this theme polarization, promise and provision, which I think is important to highlight, given that context-specific healthcare is very important, and we shouldn't just generalize across African regions. But what was a common theme throughout is that many spoke about the lack of implementation when it came to policy. So we had coaches and athletes share that in their countries, systems are there, but the implementation is just very poor, or governments have policies, the policies are in place, and there's a goodwill when it comes to disability inclusion, but many feel that these policies are just cosmetic because nothing actually comes through. The second theme is what we call making a plan. And making a plan is actually a direct quotation or direct words of what the coaches and athletes used to describe how they overcome local healthcare barriers and how they have to actively improvise. So many of these athletes did not have private health insurance, and they had to make use of public healthcare systems, which in Africa, many public healthcare systems have poor infrastructure challenges and accessibility. And so athletes and coaches shared that when it came to public healthcare systems, access to these healthcare facilities were a big challenge. Getting a doctor to seeing you in time. And so many of the coaches had to use their connections. So it's who you know. And they had to make a plan for the athletes to actually be seen to or to have a checkup. The third theme that came through was what we've called the coach as the facilitator, which might be unique to the African regions, but it also might be unique to parasport globally, where coaches have to play quite a big role in supporting the athletes. So the coaches and athletes in these African regions shared that coaches have multifaceted roles and facilitate healthcare and athlete support. So coaches shared that if the athlete was sick, they had to spend their own personal money to get the athlete transport and to take the athlete to a specialist to get care. And many of these coaches shared that they coach as part of they volunteer their time to coach. So they have their normal day jobs and they work and then they volunteer their time to coach. And so they're using their personal funds. They're not necessarily paid for the coaching, but they have to, in order to help their athletes, they have to make use of their own funds. Athletes shared that they generally, the first way to get a solution or their first way to get help is that they normally consult the coach, and the coach gives them exercises to help them, and if it's not working, then they go to the pharmacy. So when it came to athletes sharing their healthcare experiences in these African regions, many first approached their coach, and then if not, they went to a pharmacy, which they found was more accessible and cheaper than getting to a healthcare facility or a doctor. And the last theme that came through is what we call sport as a gateway to healthcare. And I think this is an important one for us working in parasport, is that we found that many athletes and coaches shared that sport functions as a pathway to better healthcare for them as para-athletes in their low resource settings. So athletes shared that they were very aware that they had certain privileges being an athlete, being associated with parasport, because they have better access to doctors and they can then have regular checkups compared to other citizens in their countries that don't have access. Many athletes also shared that generally in the day-to-day environments and settings, they don't have good access to doctors, but they only get a checkup when there's training camps. So they were very appreciative of initiatives like the GAPS program, because when they have training camps, that is when they can see the doctor and they get checked up on everything that they need to be checked up on. So sport really functioned as a gateway to improved healthcare for these athletes. And so what we concluded, this was the first, it was a novel study. So it gave us first insight into the healthcare experiences of para-athletes and coaches living in African countries. Parasport, when it comes to parasport in Africa, it seems that country-specific socioeconomic barriers to healthcare do exist, but as we said, participation in parasport may provide a gateway to improved healthcare for these athletes. Education and inclusion, still something that needs to be promoted. So when it came to healthcare, athletes and coaches navigated healthcare challenges through improvisation and resilience, and there was a call for more disability specialized medical professionals. And then context-specific healthcare is important. So investing in healthcare integration within sports structures and exploration of context-specific healthcare could better support efforts towards equitable and accessible healthcare for para-athletes globally. Thank you.